National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, a health expert here at nationalnutrition.ca. Edema is something that I often have questions in my practice about. Patients come in with swelling of their lower legs or swelling of some other area of their body, and they want to get to the bottom of it. So in case you haven't figured out from that little line, edema is essentially a type of tissue swelling. It's a fancy term, and there are two different types of edema that you can experience. There's one type we call pitting edema, where if you were to press into the swollen area, you will leave a pit or you will leave an indentation that lasts for a few seconds. And then we've got what we call non-pitting edema, which if you depress the skin where it's swollen, it pops right back out right away. So the two types of edema are there because there's a different pathology behind each type. In pitting edema, which is typically considered the slightly more serious edema, you've got generally some problem with your circulation. So because of this, what's happening is the fluid portion of the blood is oozing in between the cells, and that's causing them to separate, and that's causing a loss of elasticity in the tissue, that's causing an over-influx of fluid into the tissue, and that can cause the cells to have impairments in their ability to get oxygen, and it can actually lead to long-term damage of the tissue if the edema is not treated. In fact, in severe cases, the fluid can actually ooze right out of the skin in those areas with severe edema. It can actually cause breaks in the skin because the pressure builds up so high, and that can be very painful. It can also get very inflamed, which can then make it even further painful. Pitting edema typically happens on both sides of the body, and it can be a sign of hyperthyroidism, or it can be a sign of some level of cardiovascular disease. On the flip side, non-pitting edema tends to be a little bit more acute, tends to be only one side of the body, and although it can be very painful, it's not typically related to as serious a condition. So if you do suffer from edema, what are the things you can do about it? Okay, once you understand that you've got it, now the question is, okay, that's great, I know I've got edema, my doctor told me, what do I do about it, doc? Well, there's a few things you can consider. One of the first things you really want to work on is improving your circulatory function, because what you need to get rid of edema is you need to get rid of the fluid that is causing the swelling. And so improving circulatory function is the way we do that. And there's a few supplements that you can look into that will actually improve the effectiveness of your circulatory system. Some of the ones that I'll often recommend to patients, things like coenzyme Q10 or CoQ10 as it's commonly called. Really important for increasing the efficiency of the cardiovascular system. It basically helps your heart move more blood using less energy, and this can actually help increase blood return and fluid return to the heart and help get it out of the tissue. In addition to CoQ10, you can also look at taurine. Taurine is an amino acid that's used as fuel for the heart. And again, this can help increase the efficiency of the cardiovascular system, and that can help to eliminate edema. Another one that you'd want to look at, something like N-acetylcysteine, which is used to produce something called glutathione in your body, which is a major detoxification enzyme and can help to break down any toxic metabolites that may be building up in the tissue, leading to the development of the pain and actually causing further damage to that tissue, causing further edema. Other things you might want to talk to your physician about, something called compression stockings, where you can use outside compression to literally force the fluid out of the tissue. That can help alleviate a lot of the symptoms of edema and reduce any damage that edema has. Now, the compression stockings don't necessarily fix the problem, but they do relieve the symptom, and relieving the symptom can relieve any further damage that symptom may cause. So, getting the edema under control quickly can actually speed up your body's ability to heal from it in the long term. So, if you or anyone you know suffer from edema, please share this video with them. If you have any questions or comments, post it below, subscribe to our YouTube channel, and always remember, knowledge is health.